16% of maternal deaths each year are caused by preeclampsia or other hypertensive disorders of pregnancy. Today, I am here to inform the Communication 110 students of what preeclampsia is and the signs and symptoms, risk factors and complications of preeclampsia, and the treatment and prevention. Now on to my main point. What is preeclampsia? ClevelandClinic.org describes preeclampsia as a serious medical condition that can occur after 20 weeks of pregnancy. It can cause life-threatening complications, and the only cure is childbirth. The World Health Organization listed the following as symptoms of preeclampsia: headaches that are persistent and do not resolve with medication, changes in vision, temporary loss of vision, blurred vision, light sensitivity, and seeing spots, high blood pressure, a blood pressure over 140/90 in most cases, and in severe cases 160/110, right-sided rib pain. When preeclampsia progresses, it can cause swelling of the liver capsule, leading to sharp or aching pain beneath the ribs, and protein in your urine. Some other symptoms include nausea or vomiting that suddenly show up in the second trimester, less fetal movement, shortness of breath, lower urine output, sudden weight gain of 3 to 5 pounds or more in 1 week, and significant swelling, especially in the face and hands. These signs and symptoms are important to know because preeclampsia can be fatal to both the mother and the baby during pregnancy if it is not caught early enough. Having only one of these symptoms does not mean that you have or will get preeclampsia, but could aid in early detection. On to my next main point, the risk factors and complications of preeclampsia. Any pregnant woman past 20 weeks of pregnancy can get preeclampsia. Those who are at a higher risk of preeclampsia are women that have a history or family history of preeclampsia, pregnant women who are expecting twins, triplets, or more, women with autoimmune conditions, pregnant women that have history of high blood pressure, kidney disease, or diabetes, pregnant women that are ages 35 and older, obesity, and complications in prior pregnancies like low birth weight. Preeclampsia is diagnosed during routine prenatal visits. If symptoms occur, the provider may order blood tests to check the kidney and liver function, a 24-hour urine collection to watch for the protein in your urine, and fetal monitoring. Some of the complications that come with preeclampsia are eclampsia, which is the most severe form of pregnancy-caused high blood pressure. It develops from preeclampsia. It can cause seizures that can lead to brain damage and is one of the major causes of maternal death globally. HELLP syndrome, hemolysis, elevated liver enzymes, and low platelets. It occurs in about 15% of pregnant people with preeclampsia or eclampsia. Complications of HELLP can cause stillbirth or newborn death. HELLP can cause stroke or liver rupture in the pregnant person. Some more complications are fetal growth restriction. Preeclampsia affects the arteries carrying blood to the placenta. If the placenta does not get enough blood, the baby may receive inadequate blood and oxygen and fewer nutrients. This can lead to slow growth, known as fetal growth restriction. Another complication is preterm birth. Preeclampsia may lead to an unplanned preterm birth, which is delivery before 37 weeks. Also, a planned preterm birth is a common treatment for preeclampsia. Baby born prematurely has increased risk of breathing and feeding difficulties, brain bleeds, vision or hearing problems, developmental delays, and cerebral palsy. The placental abruption is another complication. Preeclampsia increases your risk of placental abruption. With this condition, the placenta separates from the inner wall of the uterus before delivery. Severe abruption can cause heavy bleeding, which can be life-threatening for both the mother and the baby. An article written by Chung and Cho on neurodevelopmental outcomes on preterm infants states that preterm infants are at an increased risk for language, cognitive, sensory, and motor impairment. These delays can be caused by an immature brain, perinatal risk factors, and environmental exposures. All of these are important to know about because, again, if preeclampsia is not caught early enough, it can turn into any of these things. Or if it is caught early enough, but it's not good, knowing what can happen in your pregnancy or to your baby is important. On to my last main point, which is treatment and prevention of preeclampsia. The treatment depends on how severe the preeclampsia is and when it occurs. The only cure to preeclampsia is birth. Your healthcare provider will want you to remain pregnant for as long as possible, as long as the preeclampsia is not putting you or your baby in danger. If you are close to full term, 37 weeks pregnant, your provider may recommend an early delivery. Medication for fetal lung development may be provided, and your blood pressure will be managed until delivery. If preeclampsia develops earlier in pregnancy, like shortly after 20 weeks, your provider will monitor you closely. You may have more frequent appointments to monitor your urine, blood pressure, and fetal development. In severe cases, some pregnant women with preeclampsia have to be hospitalized for monitoring until delivery. If preeclampsia is caught early, some women are prescribed blood pressure medications, monitor blood pressure at home, have frequent urine checks, and go on light duty or full bed rest. Those with a prior history of preeclampsia will be recommended to meet with a maternal fetal specialist for extra monitoring, take baby aspirin, and monitor blood pressures at home. In most cases, preeclampsia will go away on its own within 48 hours after childbirth, although it is rare. Postpartum preeclampsia can occur weeks after the baby is born, and it can be severe. I have just discussed 3 main points: what preeclampsia is and its signs and symptoms, the causes and risk factors, and treatment and prevention of preeclampsia. This topic is important for expecting mothers to aid in early detection and prevention of a possibly fatal outcome. 15 to 25% of women diagnosed with gestational hypertension will develop preeclampsia, and 5 to 8% of pregnancies result in preeclampsia. 15% of preterm deliveries worldwide are due to preeclampsia, and 16% of maternal deaths are due to preeclampsia and other hypertensive disorders of pregnancy, which is why it's so important to be educated on this topic going into and at the very beginning of each new pregnancy.